Why they what?
Why they threw it against us. I don't think they completed the pass.
Let me tell you something right now. You got 7 seconds left. You're on the 35, you're on the 25-yard line. No,
Kicking field goal.
don't do this. This is called delay game. You are coach. You not watching that clock? Hey,
Why
n-
did you kick a field
now it's 3rd and 15. And then guess what? You're not telling.
You don't want to be 17, 16. Because you play car second. You're done. That's
Where?
it's 17, 16. Whoever wins that one plays car. Yeah. It's just special place. I like it over there. I like their band.
All right, everyone. I apologize for the delay. I would like to use the daylight savings time excuse, but I'm going to use the real excuse. I'm not as perfect as everyone thinks I am. I mismanaged my calendar. I apologize. At this time, we would like to call this Insurance and Finance Committee meeting to order. If everyone would please stand for and join us in the pledge. Pledge allegiance.
To the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
All right, Mr. Superintendent, Mr. Bajeron could not make today's meeting, as you know, but we do have a quorum because we do have Mr. Edmond here, and we also want to welcome Mr. David Lejeune to our meeting as well as a fellow board member. At this time, I'd like a motion to approve the minutes from the Board Insurance Finance Committee meeting from October the 15th, 2025.
I'll make a motion to approve the from last month's meeting.
Well said. I'll second. Is there any public comment on the minutes from the previous Insurance and Finance Committee meeting? Any board member comment? All right. Hearing none, Madam Secretary, please call the roll.
Mr. Edmond? Mr. Hidalgo?
Yes.
And Mr. Bajeron is absent. 2 for, none against. Motion
I'm sorry.
carries.
Yes.
Motion carries. That's good. All right, let's jump into our agenda item, item 2.2, discussion and our action regarding the Gallagher report. I don't know who's presenting today, but would the appropriate folks come forward? Ms. Melody, welcome. If you would, make sure the mic's on. And as usual, please speak clearly into the mic. I'm sorry? No, ma'am.
Thank you. It's good to be here today. If you don't mind, I'm going to ask Trish to handle the video presentation. I'm not real familiar with that computer. Okay, so this is the agenda for today. We're going to talk about stop loss, our annual service calendar, and then we have some additional information in the appendix. We were asked in the workshop to better describe, what is stop loss. So you know that you have a self-funded plan, but the worry is if we have some very, very large catastrophic claims, what you've been doing and what you should continue to do is buy what we call specific reinsurance. And what that does is it helps mitigate the very large claims, and it carves it out and it sends it to the reinsurer for them to reimburse you. We've added a slide to kind of talk about specific stop loss. Again, it's for catastrophic high-cost claims that really you have no control over. I think in the appendix we're showing what those conditions can be. An awful lot of times it's interesting, we don't see a pattern of an illness, it's an acute onset. So, when they pop up when you least expect them, which is one of the reasons why you buy specific reinsurance. We've added this to just kind of share, where's the appropriate level of reinsurance. As you can see, you would fall into that 5,000 life category, and it indicates that, you're somewhere between 500 and 750 on a benchmark perspective. Please let me know if you have any questions.
Ms. Melody.
Yep.
I know that we have a very short agenda, and I want to respect everyone's time, especially since I was late, but
Right.
I do want to make sure that everyone understands exactly what this is. And if we can break it down to a third grade level, just so everyone understands.
Okay. So we know we have about $70 million to spend, and that includes your prescriptions and that includes your medical claims. We know that some claims are fairly predictable. A group of your size is actuarially credible, is what they say, meaning that as we come up with that budget year over year, we really shouldn't be too far off. But where we could be off is if we had a rash of very, very large claims. We have claims today that are $2 and $3 million of expense. We have specialty drugs for what we call orphan diseases today that are curing things like hemophiliac, dwarfism, conditions of children that are gene-based. And so those claims come quickly. And, you know, a child born with a genetic disease, a person with dwarfism, a hemophiliac, those aren't claims that we can really manage. Those are claims that are just going to occur. So to prevent ourselves from this unknown catastrophic problem, we buy a layer of reinsurance. So embedded in the budget, we have expenses like TPA expenses to process the claims. We have network expenses. We have management programs that we've implemented to try to, you know, curtail some of the chronic conditions which appear to be working. But embedded as well in that budget is money that protects us for the very large claims when they come as a very quick onset. Does that help?
It does. And to further simplify, let's just assume we have a major, let's say a cancer case, because that's typical, right? You know, we cover cancer, and we will. But some of these claims get extremely high. So currently, prior to today's conversation, anything over $500,000 is covered by a reinsurance. It's covered by additional insurance that we as a school system purchase to make sure that that claim is paid, and it's not coming out. If it came out of our budget, then certainly our insurance costs, our premiums, everything would be much higher, because then we would be at risk for that entire amount. So just to kind of, you know, if you guys have any questions, now's a good time, but at the end of the day, it's to explain that the reinsurance, the stop loss, we use those terms interchangeably, is to cover anything over a certain amount. Currently, as of yesterday, it was $500,000. They're going to go into this year's proposal, because there's a new proposal on the table, but currently it's at $500,000. Anything over $500,000 gets thrown out from Lafayette Parish School System's liability into the reinsurance.
And to even further illustrate, we have an example of a specific deductible of $600,000. So in this example, the district would take on responsibility of claims for one individual up to $600,000. So in this situation, we're showing claimant number one with the $650,000 expense, number two, $625,000 expense, $675,000 on the third person, and $635,000 on the fourth. So in this case, the district would be responsible for the first $2.4 million of claims, and then the reinsurer would have reimbursed you $185,000. The example that they put together is real. I mean, every one of these claims are over $600,000, but again, I want to caution you that we're seeing $2 and $3 million claims.
So what's the benefit of going up to $600,000?
The benefit is that you pay less in premium. Okay. As well, you want to have an appropriate level of where the reinsurer takes risks and where you take risks, because there's a compounding effect of these large claims that put you in a better spot if you can continually graduate higher. As we continue to manage the plan, I'd like to see that specific stop loss increase if we can. just so that we can pay less premium if possible.
And is that renewed yearly? What
Say it
we
again,
do?
I'm sorry.
We renew it yearly?
Yes.
Yeah,
Mhm.
okay.
It's an annual contract. So this is where we landed with the renewal. We go to the market, we ask reinsurers to come back with their proposals. Again, to Mr. Jeremy's point, we've increased the specific deductible to $600,000, and we have what's called an additional layer of $325,000 of risk. It's interesting, this little layer of additional risk is a dollar for dollar premium exchange with the reinsurer. And what it says is if any individual exceeds the $600,000 specific, or if several people exceed the $600,000 specific, you actually aren't going to get reimbursed until you satisfy this additional pool of $325,000. But what we got in exchange for that was a reduction in premium of $325,000. It does two things. There's a likelihood that you'll spend that $325,000 on claims. But as we continue to get premium increases, let's just use an example of 10%. It's 10% of a lower number. So we've taken that risk out of the premium, and we don't have that compounding effect on the premiums year over year.
So can I just add to that? I think to make it clear for me is that, from what I'm understanding you're saying, let's say that we have 3 claims that are worth $1.5 million. So 3 different claims, $1.5 million. You're saying that before they're going to reimburse us, from that $600,000, we're going to come up and have to pay an additional $325 before that $600,000 is there. Okay.
That's right.
And so for us to be able to keep the claims down, so we're basically, we're seeing that, we're playing the market is what we're trying to see whether or not,
We're trying to beat the house.
Okay, got it.
So I guess that the most important point I should make is that the increase of the reinsurance is not affecting the budget. So when you think about this number compared to the several $1 million that we've paid, this has been taken into consideration. As a matter of fact, I believe the budget number was 42%, but remember, we are taking more risk. But the additional risk would be in claims, and as we've actuarially counted what we think that's going to look like, we're still absolutely within budget.
So what Ms. Melanie is saying is when the board adopted Fund 85 budget in the spring for the fiscal 26 year, which we already built in an increase because we knew stop loss was predicted to go up. So through all of this, we're not asking any more money to come from Fund 85. We did it through the budget season, predicting that we would have an increase.
So to take it further, we don't have a crystal ball. We don't know what's going to happen moving forward. However, if we look at this quote and we apply it to last year, let's just pretend for a minute that last year we had gone with these limits. Where would we stand today knowing the claims we had last year? Because if I remember right, some data that was presented at some point, I don't think it's here, but it showed the highest claimants over the stop loss.
Right.
And so if you use that data and you apply this stop
Logic,
loss,
right.
this logic, how would we have, as a school system, come out if we had had the 600,000, the same plan here last year?
Jeremy, I just don't have that with me, but we did go through that analysis.
Okay.
And not only did we do that, we benchmarked it against kind of where you should be. And you can see with benchmarking, you should have a higher specific deductible.
Well, yeah, I can't imagine that you didn't do the analysis, and I can't
Yeah.
imagine that if you did the analysis, you would recommend this, but I guess what I'm trying to say is, would we have come out better or flat?
And that is something that we look at. I just don't have it with
Okay,
me.
that's fine.
And even know this, when we do go through that analysis, we also trend those claims and we also mature those claims. So it's not just kind of a snapshot of what have you paid thus far. We do try to predict what we think is in the hopper.
Do you think that, and again, after the meeting, can you think you could provide that to us and the board members based upon our data from last year, if we would apply this 600, also, along with the aggregated cost, what it would have cost?
Mm-hmm.
Okay, thanks.
So with that, moving on to the next slide, that really covers reinsurance.
Before you go into the next slide, because it's a different
Yes.
topic.
Okay.
Basically, we budgeted higher knowing that, or assuming we would have a higher stop loss. They're within budget, so that this doesn't require to go back to the board. However, it is higher than last year, as expected.
Yep. Any questions? Hopefully, I kept it as simple as possible, but gave a little clarity. Okay, we are finishing out calendar year 2025. We had a lot on the calendar. We've accomplished an awful lot of good things. We're in the midst of creating the calendar for 2026. One of the items that moved off of 2026 and moved on to 2025 was preparing for a market check on the wellness program. So that's what's different from what you've seen before. But in our next meeting, we'll outline what our initiatives will be for 2026.
Do you guys keep adding stuff to this calendar?
Yes.
Because it never shrinks.
Oh, Lord. It's never going to shrink.
Good.
As healthcare evolves, we evolve.
Committee members, do you guys have any questions? Mr. Lejeune? Superintendent? I know you're not technically on the agenda, but do you want to give a very brief overview of how open enrollment went?
It's hard.
We are in the midst, still in the throes of trying to wrap up open enrollment. We are working with Meritain to enter that information into the system. I can at least give you some very broad strokes. We had over 375 total changes, of which 93 members transitioned from our current Blue Cross plan to the Humana plan, which is the LPSS Medicare Advantage plan. Along those 375 total changes, 123 were additions. That's not including the belly buttons, but just member changes. 206 were actually changing to other plans. So we'll go from perhaps basic to high deductible. And then the remainder of those changes were cancellations, either canceling a dependent or canceling the entire contract. But we're working through those changes currently. I don't have the specifics to those answers, but we are wrapping it up. We've got a lot of transition between the Meritain and the pharmacy changes that we're also working through.
Tricia, I don't want to put you on the spot. I know you talk to my team all day long.
Okay.
But just quick question, just in case you have the answer.
Okay.
I'm kind of curious. Has anybody moved from Humana back to the self-funded plan?
If I'm saying this accurately, and Ashley would probably be the person to ask, I believe we had 2 members transition back from Humana. One member, without giving a lot of details, was just out of state. It was not working for that member based on the area that they were in. And I don't have a lot of details on the other member, but 2 of the members from the over 236 that transitioned last year, only 2 are transitioning back to the current group health insurance plan.
How many are
Great news.
total now on Humana?
Don't quote me. I believe the last numbers for November were 736, and if we're adding 93,
That would be my,
then,
I'm guessing the same number.
yep. So we'll be closer to 1,000 here once we make these transitions, and we currently have members coming in with Medicare cards who are all automatically saying, put me on the Humana plan.
And that's from under 300. year and
Yes,
a
sir.
half
Over
ago.
the last 2 years, we've jumped quite a bit. 2025 saw 236 increases of members transitioning from Blue Cross to the Humana plan.
One thing, fellow board members, I'd like to say is that the folks who are transitioning from, let's say, the basic or the enhanced plan to high deductible, that does have an impact to our insurance plan. So, and not just board members, but public, when you see the difference coming up, moving forward, 6, 8 months from now, and they're presenting something to us and it doesn't match up what they predicted, this is one of the major factors that has a lot of play. I mean, folks are saying, hey, look, I'm going to take more of a gamble. We're more healthy, so we're going to go on the high deductible plan. It's less cost, less risk, unless you have a major medical, situation. But it also impacts the plan itself. So, it's not just from on a retiree side, it's also on an active side that we have a lot of factors in the plan. Superintendent, did you have something you wanted to say? Okay. All right, any questions? All right, Superintendent?
So let me first of all start with, again, I want to thank Dr. Robley and the entire academic team. I want everyone to know that during our school visits, we made it very clear to the leadership at each of these different schools about the importance of open enrollment, making sure that everyone understands vesting and knowing what was at stake. The one thing that we did not want to do is make sure that we just relied on what Trish and them were pushing out. So we really pushed those things on those individual visits, and I think it has really gotten to the employees. Secondly, I just want to thank you, Trish, and your entire team. I know this has been a big lift, especially with all of these different changes that we have tried to implement, and knowing that there was going to be a moving in a different direction. We have a lot of different things that I will tell the audience here, along with our employees, retirees, that I'm very much looking forward to January 1. A lot of these initiatives, as far as RX plan, as far as our new network, everything that we have planned as far as savings are concerned, we should start to see, my hope, start to see some relief in this particular plan so that we can somewhat, listen to this, create our own fund balance. Like, it would be nice to have our own fund balance so that if we do get into a year where it's not good, we're able to kind of dip into that. Right now, we cannot. And it drives our finance people crazy that when we create an account, such as the health insurance, and we have to go pull money and bring in from outside that is outside of our budget that we put in. So thank you for that. Last but not least, I want to thank Gallagher. You guys have taken us from a direction that I can tell you as a superintendent that we needed to go in a different direction. I'm not saying anything about what has happened in the past, but I will tell you that there are some things that needed to change, and you guys were right on the side of us, partnering up with us, providing the support for Trish and their team to make sure that decisions that have to be brought to this finance committee, board, et cetera, were the right things. And listen, again, these initiatives that I just referred to, a lot of them were led by you and your team, Melanie, and I just want to, first of all, thank you. And then again, this to me is hopefully the step in the right direction. I also would be remiss by saying that we are doing some things unorthodox as far as health insurance, but it's going to yield some great things that I really believe it's going to give some relief to this health insurance. A lot of this, you know, again, is led by Mr. Hidalgo and his direction and what he wants to see as far as this. I just really feel that we are, guys, we are close. January 1 will be here before we know it. And all of these different measures that have been put in place will start to kick in, and we start to hopefully 6 months from now, 6 months from them, a year, we'll start to see some relief in this fund. So I'm extremely proud. We have come a long way, and I'll tell you, tribute to all of you guys that are working behind the scenes and doing this hard work. It's truly appreciated.
As well, we thank the insurance committee and the board.
All right. If there are no other comments from the podium, that is the last item on the agenda. This meeting is adjourned.